Hello, I'm Sara Stapleton, functional medicine practitioner at Merritt Wellness. I have years of training and experience in treating infertility and reproductive health issues. Approximately 1 in 8 couples in the U.S. have trouble either getting pregnant, staying pregnant, or both. And common fertility challenges include things like endometriosis, polycystic ovarian syndrome, thyroid issues, poor egg quality. And we can't overlook the role of sperm quality. After all, it accounts for 23 of your baby's chromosomes and is responsible for the placenta and the umbilical cord. In our prime reproductive years and under ideal circumstances, a 30-year-old woman has about a 20% chance of conception each time she ovulates, which is about 12 times a year. So it's a 1 in 5 chance. The health of your child in utero and throughout their lifetime depends largely on the health of the egg and the sperm that create them. And as a potential parent, it only makes sense to gather the healthiest building materials possible for your potential child. Today's babies come into the world pre-polluted from endocrine disruptors found in things like plastics, food, personal care products. Studies have found an average of 200 industrial chemicals and pollutants in the cord blood of newborns. Toxins affect fertility in 3 primary ways. 1, hormonal disruption and dysregulation. 2, damage to the reproductive system, both hers and his. 3, reduced viability of the fetus and increased odds of miscarriage. So with that in mind, think about how mold illness, or CIRS, chronic inflammatory response syndrome, could lower your odds of getting pregnant and having a healthy baby. By far, CIRS is most often caused by exposure to toxic mold in a water-damaged building, but it can also be caused by a few other toxins, most notably Borrelia burgdorferi, the bacteria responsible for Lyme disease. The immune system of a person with mold illness is chronically dysregulated and hyperreactive. Multiple body systems can be affected with a long list of symptoms from brain fog to digestive issues, joint pain, fatigue, the list goes on. And with so many different types of symptoms, you may not know what type of physician you need to see. And it's almost certain that your OBGYN or fertility doctor aren't equipped to treat your overactive immune system. In fact, you may have run the doctor gauntlet only to be given no definitive diagnosis and no real resolution. Why? Because most practitioners aren't trained to accurately diagnose and treat CIRS. The only diagnosis and treatment protocol for CIRS that is supported by decades of research, scientific data, and clinical proof was developed by Dr. Richie Shoemaker. The first step to resolving mold illness, or CIRS, is to find a practitioner who is trained in effectively using the Shoemaker protocol to correct the immune system and not simply manage symptoms with diets and supplements. If you think you may be having issues from exposure to mold, or you're simply interested in learning more about mold illness, click on the link for Moldy to Healthy for a PDF filled with helpful information. If you're struggling with infertility or reproductive health issues that you think could be attributed to, at least in part, to toxic mold exposure, reach out to us at Merritt Wellness and arrange a time to speak with me personally or any of our other Shoemaker-trained practitioners.